before I get, want to get to a line of questioning, but I'd like to respond to some of the things that Democrats have been saying and also their witness, Mr. Woodhouse. We heard Mr. Smith debunk one of the claims about a facility that closed in his district. I also want to say that the data that he cites, about 800 hospitals are at risk of closure. That data was available, and the data he's using was from 2019, well before the bill that Republicans passed was even being considered or passed into law. He also quoted, and Democrats have quoted, 15 million people who will lose their health care. I've seen you all nod along. Do you know who's going to be losing their health care? Does any of you know? The 15 million people that will be losing their health care? Anyone? CBO actually addressed this, and I'll tell you who it will be. So 6 million are able-bodied adults without dependents who are working age, who choose not to meet modest Medicaid work requirements that have been put in place with this bill, or they choose not to fill out common sense Obamacare verification forms. We want to ensure that taxpayer dollars are being spent on people who truly need it. So that's 6 million of them. 1.4 million are illegal immigrants. Some states allow illegal immigrants to access benefits. That's 1.4 million. 3 million are people already ineligible for Medicaid, and they simply haven't been removed from the program yet, or have access to other subsidized coverage besides Medicaid. And 5 million are potentially due to the expiration of the expanded Obamacare tax credits that Mr. Woodhouse talked about that have increased costs. Those were put in place by Democrats, set to expire, and we're seeing the cost increase because of that. That is what CBO has said about the 15 million people who will no longer be eligible. The other thing about Obamacare, which Mr. Woodhouse talked about, the cost of Obamacare premiums has doubled in the last 10 years, has gone up well above business insurance plans, and in fact is almost double, 180% of a business insurance plan that would be comparable. So there's a lot of work to be done. There's a lot of blame on Republicans, but those are just some of the facts. I want to talk a little bit. I noticed one of you is a for-profit, 3 are not-profit. And of course, we in the tax code designate nonprofit status for companies that are providing some public benefit. And of course, the federal government gives up tax revenue as well as local communities. So for instance, in my community, Lancaster City houses a lot of Penn Medicine's facilities and forego or do not receive tax benefits as a result of that. When I look at your systems, I don't know that I see a lot of difference between a for-profit and a nonprofit. Mr. Hazen, you're the for-profit. Do you think there's much difference in the way hospitals that are designated for-profit operate differently than a nonprofit?
Thank you, Congressman. I've had this question posed to me many times, and the short answer is no.
Okay, thank you. And I'm sorry, I'm running out of time. I'd like to go to Mr. Lassiter. Your compensation seems to be maybe on par with a for-profit. Your compensation was 21 million last year. Is that correct?
That's not correct.
Okay, what was it?
It was 14.
14 million? Okay. Is that in par with what a for-profit would be receiving, or is it more?
Well, I can't answer that explicitly. What I can say to you is
Do you think that your system is using some of what would have been paid in taxes to compensate you?
No.
Do you think that public benefit includes $360 million invested by your organization in Central America and Europe?
We have no operations in Central America.
You invest in publicly traded securities?
Okay.
Is that right? $718 million invested in publicly traded securities, $134 million gain by those securities?
Yes.
163,000 spent on board meetings in Europe, Canada, and Mexico?
That's not true.
Okay.
We do not hold board meetings.
Can
in
you
the country
explain to
outside the
me
United States.
why you should be granted nonprofit status? Sorry, Mr. Chairman.
So on an annual basis, Common Spirit delivers about $5.2 billion a year in community benefit. That is approximately 12 times the value of our taxes foregone. When you think about the community benefit that my organization...
And I'm really sorry I'm out of time. I would love to ask Mr. Hazen how much community benefit they provide just for comparison, because they being a for-profit, but I know I'm well out of time. Thank you, Mr. Chairman.